Hey everyone, ready for a deep dive into a topic that can be a little bit, well, heavy.
Yeah.
We're going to be talking all about hysterectomy today,
Okay.
breaking it down so it's easier to understand,
Yeah,
and so you can talk about it with your doctor.
exactly.
Think of this like
Mm-hmm.
like getting ready for the big game.
Oh, I like that. Arming yourself with knowledge, right?
Yeah, exactly.
So you can feel more confident
Right.
making decisions and talking to your healthcare team.
Of course, this isn't a replacement for actual medical advice,
Right.
but it's a good way to get informed.
Mm-hmm.
So first things first, let's make sure we're all on the same page.
Okay.
What exactly is a hysterectomy? We hear about the uterus,
Mm-hmm.
but what does that really mean?
It's the surgical removal of the uterus.
Okay.
And you're right, the uterus, big part of the reproductive system.
Right.
And after a hysterectomy, pregnancy is not possible.
Okay, that's a major change.
Yeah.
Now, I remember reading that
Mm.
sometimes other organs are mentioned too, like the cervix, ovaries, fallopian tubes.
Yes, those are all part of the system as well.
What's up with those? Do they always come out too?
Well, that's where it gets a little bit more,
Okay.
individualized.
Hmm.
Those organs may be removed
Okay.
during a hysterectomy, but it's not always the case.
So it depends on the reason for the hysterectomy.
Exactly. Like, if it's for fibroids,
Uh-huh.
those other organs might be totally fine.
Oh, interesting.
But if there's a concern about, let's say, ovarian cancer,
Okay.
then removing the ovaries might be recommended.
Gotcha.
So it's really a decision you make with your doctor, weighing the benefits and the risks for your specific situation.
Okay, makes sense.
It's very individualized.
There's not just one way to do a hysterectomy, is there?
No, there are a few different approaches.
Can you walk us through the different types of surgeries?
Absolutely.
I remember reading about open surgery.
That's the more traditional way,
Uh-huh.
where a larger incision is made in the abdomen.
Okay, and that sounds pretty intense.
It can be,
Yeah.
and there's usually, a longer recovery time.
Hmm.
But thankfully, there are less invasive options now.
Less invasive. Okay, so like smaller incisions.
Much smaller.
Okay.
Usually means less pain, less scarring,
Yeah, that sounds much better.
and often faster healing.
Okay, so tell me more about those minimally invasive procedures.
So one type is laparoscopic surgery.
Okay.
They use these thin instruments and a tiny camera
Mhm.
inserted through those small incisions.
Okay.
And the surgeon can actually see everything inside on a monitor.
Oh, wow. So they're not looking directly in?
Right, it's all on a screen.
That's fascinating.
And then there's robot-assisted surgery, even more high-tech.
Robot assisted.
Yeah, the surgeon controls these robotic arms,
Wow.
holding the instruments, making these incredibly precise movements.
Wow, that's incredible.
It's pretty amazing technology.
It's like something out of a sci-fi movie.
Right.
So we've got open surgery, laparoscopic, robot assisted. What was that third type? I can't remember.
Yes, vaginal hysterectomy.
Okay.
So in this one, the uterus is removed through an incision
Yeah.
made in the vagina.
And that one probably has the fastest recovery.
It usually does,
Uh-huh.
and minimal scarring since there's no abdominal incision.
Okay, so three main approaches, each
Mhm.
with pros and cons. That's a lot to think about.
Yeah, definitely.
Okay, so let's say someone's decided to go ahead with a hysterectomy.
Okay.
What can they expect before the actual surgery?
Right, the prep work.
Yeah, the lead up to the big day.
Well, your doctor will want to make sure you're in good health and ready for the procedure.
Okay.
So that means a thorough physical exam.
Mm-hmm.
They might also order some tests, blood work, ultrasound,
Yeah.
to get a really clear picture of what's going on.
I bet they want your entire medical history too.
Absolutely. It's so important to be upfront with your doctor
Uh-huh.
about any medications you're taking.
Like prescriptions and
Yeah.
stuff.
Prescriptions, over-the-counter meds, even herbal supplements.
Oh, wow. Everything.
Yeah, because some things can interact with the anesthesia
Oh. Oh.
or affect blood clotting, so your doctor needs all the info.
Full transparency is key.
Definitely.
What about food and drink before surgery?
You'll likely need to fast for a while before
Mm.
no eating or drinking for a certain period of time.
To keep your stomach empty.
Exactly. Helps prevent complications with the anesthesia.
Makes sense. Any other pre-op tips?
Your doctor might give you specific instructions
Okay.
about hygiene, hair removal
Okay.
to minimize the risk of infection.
Uh,
And they'll also talk about practical things.
okay.
Arranging a ride home, having someone to help you
Yeah.
during recovery.
So it sounds like the doctor's really focused on making the whole process as safe and smooth as possible.
They absolutely are.
Okay.
They want you prepared both physically and mentally.
All right. So let's fast forward to the actual surgery now. This could be the part that causes the most anxiety for people.
I understand.
So let's break down what happens during a hysterectomy.
Right.
What's the first thing someone can expect when they get there?
Well, once you arrive, the nurses will get you settled in.
Hmm.
Start an IV line to
Okay.
give you fluids and medications.
Including the anesthesia.
Right.
Speaking of anesthesia,
Mm-hmm.
can you explain the different types and how they work?
Sure. So you've got regional anesthesia,
Uh-huh.
which numbs a specific area, in this case, your lower half.
Okay, but you stay awake.
Yes, you're awake, but you might get some sedatives to relax.
Okay, and then there's general anesthesia.
Right, that puts you completely asleep during the whole procedure.
So if you have general anesthesia, you basically don't remember anything.
That's right, you wake up afterwards like you just took a nap.
Oh, okay.
You might feel a bit groggy, though.
I imagine pain management is a big concern for people.
It is, and managing pain is a top priority.
Uh-huh.
You'll receive medication before, during, and after to keep you comfortable.
And what about that catheter I read about?
You might have a catheter placed during the surgery
Yeah, okay.
to drain urine from your bladder,
Okay,
but it's temporary. It'll be removed later.
good to know.
Mm-hmm.
Okay, so once everything's set up,
Mm-hmm.
how does the actual removal of the uterus happen?
The surgeon carefully performs the hysterectomy,
Okay.
removing the uterus and any other organs that were planned.
Mm-hmm.
The specific steps vary depending on the type of hysterectomy.
Okay, makes sense.
Mm-hmm.
So on average, how long does the surgery actually take?
It usually lasts around 2 to 3 hours.
Oh, wow. Okay.
Of course, it can vary based on the individual
Okay.
and how complex the procedure is.
So those hours are ticking by,
Mhm.
and eventually the surgery is complete.
Right.
What happens next? What's that immediate recovery like?
You'll wake up in a recovery room
Okay.
where nurses will be closely monitoring you
Hmm.
as the anesthesia wears off.
Okay.
You might feel a little groggy or disoriented at first.
So it's normal to feel a little out of it.
Totally normal. Yeah.
Okay.
It takes a while for the anesthesia to wear off completely.
Mm-hmm.
You'll also be given pain medication
Okay.
to manage any discomfort.
What about the catheter and any other tubes?
Those will be removed as soon as you're stable
Okay.
and comfortable.
If you had a breathing tube during general anesthesia,
Hmm.
your throat might be a little sore, but that goes away quick, right?
Usually pretty quickly, yeah.
What about getting up and moving around?
So actually, early movement is really important.
Really? I would have thought you'd need to rest.
Rest is important, but the nurses will help you get out of bed and walk around
Mm-hmm.
as soon as you're able to.
Even if it's just a short distance.
Even just a little bit at first, yeah.
Why is it so important to move around so soon?
Well, walking helps to prevent blood clots,
Oh,
and it can actually speed up your healing,
Oh, wow.
and you'll still be getting pain medication.
Okay, good to know.
So you'll be comfortable.
That makes sense. Now, what about food? When can you start eating again?
You'll usually start with clear liquids
Okay,
and gradually move on to more solid foods as you tolerate them.
so bland foods at first.
Yeah, that's usually a good choice.
Okay, so we've covered what to expect physically
Mm-hmm.
during and right after surgery.
Right.
But I imagine there can be an emotional side to all of this too.
Oh, absolutely.
What advice would you give someone struggling emotionally?
It's perfectly normal to experience a range of emotions,
Mm-hmm.
like sadness or a sense of loss.
Okay.
Don't hesitate to talk to your doctor or a therapist.
It's so important to acknowledge those feelings.
Yeah, definitely.
So far, we've talked about what hysterectomy is,
Mm-hmm.
different surgical approaches, preparing for the procedure, what happens during surgery, and that immediate recovery.
Right.
But there's still more to talk about, right?
There is. We still need to cover potential risks
Oh, yeah.
and long-term considerations.
Okay.
And we'll get into all of that when we come back.
Sounds good.
Mm-hmm. Welcome back. We're continuing our deep dive into hysterectomy.
Okay.
And before we jumped into the specifics of the actual surgery,
Mhm.
we talked a little bit about the emotional side of things.
Right.
And I think it's important to carry that thread through
Yes.
as we talk about potential risks and long-term stuff.
Absolutely, because knowledge is power, right?
Yeah.
Understanding all the possibilities
Mhm.
can help you feel more in control
For sure.
of your decisions in your health.
Exactly. So let's address the elephant in the room, the risks.
Okay.
While a hysterectomy is generally a safe procedure,
Mhm.
like any surgery, there are some potential complications.
Okay.
Some common ones include infection, bleeding,
Uh-huh.
the incision reopening,
Oh,
blood clots, and potential injury to nearby organs.
that's a lot to take in. Sounds a little scary.
I understand it's important to be aware of those risks,
Okay.
but it's also important to remember that they're not the norm.
Okay.
You know, your doctor will thoroughly explain all of that.
during your consultations.
Okay.
And they'll also take steps to minimize those risks.
Okay, that's reassuring.
Yeah,
So it's really about that open communication with your doctor,
absolutely. Communication is key.
making sure you understand everything and feel comfortable moving forward.
Now, let's talk about some things that are totally normal after surgery,
Okay.
like light vaginal bleeding or spotting.
Oh.
This can last for a few weeks, and it's usually like a pinkish,
Mm-hmm.
brownish, or yellowish color.
Okay. Good to know what to expect.
Mm-hmm.
Now, we already talked about how a hysterectomy means
Right.
no more periods,
Mm-hmm.
no more pregnancies.
Big changes.
Are there any other significant changes someone might experience?
That depends on whether or not the ovaries were removed
Okay.
during the hysterectomy.
Uh-huh.
If they were, you'll basically go through menopause surgically.
Even if you haven't reached that stage naturally.
Exactly.
Right. And menopause comes with its own set of symptoms. Yeah, it can be a bit of a roller coaster ride
Okay.
with symptoms like hot flashes, night sweats, mood swings,
Oh, wow.
vaginal dryness, sleep disturbances, even difficulty concentrating.
Okay.
And some women experience weaker bones
Oh, wow.
because of those hormonal changes.
That's quite a list.
It is.
It sounds like menopause can be pretty challenging.
It can be, but the good news is there are treatments available
Okay.
to manage those symptoms and make it smoother.
Okay, so if someone's experiencing those symptoms,
Mm-hmm.
they should reach out to their doctor.
Absolutely. There's no need to suffer in silence.
Right.
There are ways to manage those symptoms and
Right.
improve your quality of life.
I think it's important to acknowledge that even though hysterectomy is a medical procedure, it can have a huge impact on someone's emotional well-being.
Absolutely.
We've touched on sadness and a sense of loss,
Right.
but are there other emotional aspects people might experience?
For sure. Some women might struggle with body image concerns, especially if they associate their uterus with femininity or motherhood.
Right.
Others might worry about changes in their sexual function
Okay,
or intimacy with their partner.
that makes sense. It's a big adjustment,
Yeah,
both physically and emotionally.
absolutely.
Are there any resources or support systems you'd recommend?
Yeah, support groups for women who've had hysterectomies
Mm-hmm.
can be incredibly helpful.
Okay.
They provide a safe space to share experiences, connect with others, and learn coping strategies.
So important to have that kind of support. Now, for someone who's considering a hysterectomy, but maybe hasn't fully made up their mind,
Yeah.
are there any alternative treatment options they could look into?
Definitely. Hysterectomy is often considered a last resort,
Okay.
especially for non-cancerous conditions.
Uh-huh.
So depending on the issue, there might be medications, hormone therapy,
Okay.
or less invasive procedures that could address the problem.
Without removing the uterus.
Exactly.
So it's really important to talk through all those options
Yes.
with your doctor.
Mhm.
Weigh the pros and cons.
Absolutely. It's about finding the best solution for you,
Okay.
taking into account your individual circumstances,
Makes sense.
your medical history,
Yeah.
and your personal preferences.
Now, we talked earlier about being upfront with your doctor,
Right.
about medications and supplements.
Mm-hmm.
But what about lifestyle factors?
Yeah, that's a great question.
Are there any changes someone can make before surgery
Definitely.
to help with recovery or reduce risks?
There are things you can do to prepare your body and mind.
Okay.
Quitting smoking is a big one.
Okay.
It can really improve healing and reduce complications.
Makes sense. What about diet and exercise?
Eating a healthy diet and getting regular exercise
Ugh.
can also make a difference.
Okay.
It's about strengthening your body overall,
Yeah.
which can help you bounce back quicker.
It's like training for a marathon in a way.
I like that analogy. And this might seem obvious, but getting enough sleep is crucial.
Oh, yeah.
When you're well rested, your body can really focus on healing.
It's amazing how much those simple things can impact
Yeah,
our health and well-being,
definitely.
especially during times of stress or recovery.
Absolutely. Taking care of yourself holistically makes a difference.
Now, I know this is a delicate topic, but I
Yeah.
think it's important to address.
Okay.
For someone who's had a hysterectomy
Mm-hmm.
and maybe is experiencing those menopausal symptoms,
Yeah.
how might their sex life be affected?
It's a very valid concern, and it's important to remember
Mm-hmm.
that every woman's experience is different.
Yeah.
Some women find their sex life remains largely unchanged.
Okay.
For others, there might be some adjustments.
What kind of adjustments?
Well, hormonal changes due to menopause can
Mhm.
sometimes lead to vaginal dryness,
Okay.
which can make intercourse uncomfortable.
Right.
There are lubricants and moisturizers that can help. And your doctor can also talk to you about hormone therapy.
So there are options to address those physical changes.
Mm-hmm.
But what about the emotional side of things?
That's equally important.
Yeah.
Some women might experience changes in their libido
Yeah.
or feel differently about their bodies after surgery.
Mm-hmm.
Open communication with your partner is crucial.
Yeah.
Talk about your concerns, explore new ways to be intimate,
Right.
and seek professional guidance if needed.
It sounds like it's all about adapting
Yeah,
and finding what works for you and your partner.
exactly. And remember, intimacy goes beyond just intercourse.
That's a great reminder.
Mm-hmm.
Now, before we wrap up this part,
Okay.
anything else you'd like to add about long-term considerations?
I think it's important to emphasize that while a hysterectomy can bring relief from some medical conditions,
Mm-hmm.
it's a major decision with lasting consequences.
Okay.
It's not something to be taken lightly.
I agree. It's crucial to weigh those consequences carefully, both physically and emotionally.
And remember, the decision is ultimately yours.
Mhm.
It's about what's right for your body and your life.
Well, we've covered a lot of ground in this section,
Well, yeah.
from potential risks to long-term considerations, including menopause, emotional well-being, and intimacy.
Absolutely. And I think it's important to reiterate
Okay.
that this is just a starting point.
Yeah.
The information we've shared is meant to empower you
Mm-hmm.
to have those informed conversations with your healthcare provider.
Wow, it's amazing how much we've learned about hysterectomy.
I know, right? We've gone from the basics Yeah. all the way to the emotional and intimate aspects.
Yeah, we really went deep, and hopefully we've shed some light on a topic
Yeah,
that can feel kind of mysterious
definitely.
and maybe even a little scary.
It can be a lot to process.
So if someone's listening and thinking,
Mm-hmm.
wow, where do I even begin?
Right.
What's the first step they should take?
I would say first, gather your thoughts and questions.
Okay.
Write them down, make a list,
Yeah, make a list.
whatever works for you.
Yeah.
And then schedule an appointment with your doctor.
Okay.
Could be your primary care doctor or a gynecologist,
Mhm.
and bring that list with you.
Yeah, and don't be afraid to ask those questions.
Exactly.
Yeah.
Even if they seem, silly or embarrassing,
Right.
there's no such thing as a stupid question.
Especially when it comes to your health.
Exactly. Your doctor's there to help you.
Not to judge.
Right.
Now, we've touched on this throughout our deep dive, but it's worth repeating.
Yeah,
Every woman's situation is unique.
absolutely.
What's right for one person
Mm-hmm.
might not be right for another.
That's why that open communication with your doctor is so important.
Exactly.
You're working together to make the best decisions.
For your specific needs.
Exactly.
So as we wrap up this deep dive,
Mhm.
what's one final thought you want to leave our listeners with?
I would say if you're considering a hysterectomy,
Okay.
or even if you've already scheduled it,
Mm,
remember this. You are not alone.
that's so important.
There are resources out there to support you.
Yeah.
There's information to guide you, and a whole community of women who get it.
Who understand what you're going through.
Exactly.
It's about feeling empowered,
Yes,
informed, and supported
absolutely.
throughout this entire journey.
Taking control of your health,
Mm-hmm.
making choices that are right for you.
Well, I think we've covered just about everything
I think so too.
about hysterectomy.
We really went deep.
Yeah, we explored all the complexities and hopefully
Mm-hmm.
help people feel a little less anxious.
It's been great sharing this information.
Absolutely. Thank you so much for joining us.
My pleasure.
And as always, thanks to everyone for listening to The Deep Dive. We'll see you next time
Bye, everyone.
for another fascinating exploration of a topic that matters to you.